In the summer of 2014, Crescent Care celebrated the opening of its first family care center, marking a rebirth of one of New Orleans' most respected service organizations, the No AIDS Task Force. The transition might not have succeeded without the guidance of Sage Growth Partners. The term AIDS had barely entered the nation's vocabulary when No AIDS began providing essential care.
No AIDS Task Force is a community-based HIV AIDS service organization. It started 30 years ago. A group of men and women saw the need to come together and do something about men that were getting sick, going into the hospital, and many not returning home.
In a city with a critical need for its services, the agency grew along with the demand. But the AIDS epidemic started to ebb in the 1990s, just as community health centers were becoming more popular. Doubts were raised about the viability of a single-issue organization.
The concern was that with so many resources going into community health centers, that it might be likely that we would see fewer resources earmarked for HIV services.
Thousands depended on care that only No AIDS offered, and that care was in jeopardy.
So we started thinking about the possibilities of either partnering with community health centers or becoming one as an organization. It was a difficult decision to even think about moving or expanding services beyond HIV.
One of the biggest issues for No AIDS, especially for the board, because we have been in the community for 30 years, was to not lose sight of our mission and who we have supported all of these years and who has supported us.
The board struggled with the issue for a number of years. Then, August 2005 happened. No AIDS depended on government grants. That aid had been reliable in the past, but now there was a greater need, and the funding disappeared.
Without any additional cash flow, it was pretty apparent that we needed to look at shutting the agency down, whether it was going to be temporarily or permanent.
If it was to stay in business, No AIDS would need to alter its image and its business model. But the board wasn't sure it was ready or able to do either.
We needed to do something different. We needed to think forward. We needed to think into the future about what healthcare delivery might look like in our community. And without everyone in the same room at the same time, hearing the same things, that was difficult to do.
So the board asked Sage Growth Partners to conduct a one-day intensive strategic planning session. It was a watershed for the organization.
What I think changed on that day was a group of folks who had grown from a social service organization that was really interested in the soft side of it, recognized that we were a business and that if we were going to continue to do that soft side and those services, we needed to have a business-like approach.
It was very important and it was electrifying at that moment because people were realizing, wow, we're having a debate about this and we haven't discussed this enough before. We were the catalyst, they were the ones who had the answers, and we helped to bring those answers to the surface.
One was the realization that primary care would only enhance the services No AIDS offered its clientele and would help the agency expand its reach in the community. A bigger question was the business model and the uncertainty it could succeed in that market.
So Don got up and did this presentation about what was going on in the world, in the world of health centers, all of this sort of financial stuff that I don't think a lot of our folks were ready to hear yet. And I think he saw some eyes rolling, but then he said, you know, at this point, you're at a crossroad. You either go big or you go home.
It's a gut check at that point in time, and we really felt like this was an organization that had its act together. They were doing things for the right reasons, and this was in what I would call a squeeze time frame where they were either really going to leverage all of the hard work that they've done, all of the the assets and endowments, all of the investments they had made in the community and the community investments in return, they were either going to capitalize on those investments, or they were going to basically be minimized and diminished and their impact mitigated. And I think that they answered the call. But that was really what I was talking about at that point in time, was just, it's really time to go to the next level, because the community needs you to take this to a different level.
Chris and the SAGE group really jumped in and did a very thoughtful needs assessment from a business perspective, and helped us to develop a strategic plan that went over 5 years.
Part of our experience in New Orleans, and part of the experience about going big or going home, is look in the mirror, let's change your own perception of who you are and what you can command, and the market that you're going to drive and control. Change how you think about yourself. You're not some little rinky-dink organization that's barely holding on. You're a powerful force to drive good in your market. And so we want to be a catalyst for driving that good.
We had expertise as HIV provider. We did not have expertise in providing primary medical care to a larger community. And turning to SAGE, it was a great partnership in that SAGE had the benefit and the experience of understanding community health care delivery and making sure that there was a business model that was going to ensure that the organization was going to be able to operate without financial loss.
The mission without the business orientation is really a failed promise. It's really you're letting your constituents down, your customers down. So the business structure becomes really important. And I think we bring some insight into the business structure that, when it's married with the mission orientation, can be incredibly powerful.
Having SAGE partnership there provided the expertise or the missing skills that we did not have internally to help move us forward.
I don't think we could have done it without SAGE, because we're a nonprofit organization. Business is not our forte. We were walking into a whole new realm of applications and requirements and qualifications that we were not used to dealing with. So having someone help us and walk us through and guide us through that process, I think played a huge part in our eventual acceptance.